He has a little bit of arthritis in this wrist. That happened, I think, from overuse, actually, from not having that leg, just from too much weight bearing. So it breaks down all the kind of fibrous tissue here is kind of too low and it's uncomfortable. So we do some points, for that. But when he had his setback and he was able to walk about a month and a half ago, he had screaming back and neck pain. And he couldn't get up and couldn't hold himself up to go to the bathroom and all that stuff. So we do a little bit more for that. I see all tripods have a little bit worse back problems. I think it's just because they altered their body mechanics a little bit, and even if you just have a limp, your back will hurt. So imagine if you completely alter your gait, which they have a totally different walk, than a dog with 4 legs. So I think that you put a little more stress on the back. So I think that may be why I think we see this pretty often. It is going to happen with older dogs anyhow, but I think that they probably twist a little bit more. But the good news is, guys like him, he's like rowdy and back to how he was before. So that's what's nice, is so many things that dogs get now with rehab and acupuncture and stuff besides just drugs, can help them. But before he came in here and we had this setback, he was just on a bunch of pain meds and he wasn't getting better. And the owner was like, I don't know what to do, but it's nice is that now there are things to do. So I think that's what's so cool about dogs like him. He said, I'm back. I'm back and I'm ready to go. I know you don't love this one. I know you want to think about doing something else. Oh, that was so good. Oh, you're so great. Yeah, here's your cookie. Okay.
And what does the acupuncture do?
What does it do? It's magic. From a Western perspective, like from what the words we all talk about, it can bring circulation to the area where the points are. It can decrease pain from those local points, just from the local circulation. Also has what we call segmental, or some endorphins and other different kinds of neurotransmitters get released at the spinal cord area. And then also it goes to the brain and releases happy feelings like serotonins and stuff like that. Basically it makes them high in a really good way, but it also brings circulation locally, so it will help those specific areas. But Eastern medicine, that's a whole other thing. It's funny. It would say, it unblocks his chi, it moves, it removes stagnation, it changes his heat and cold status, it makes him more yin because he's more yang. All these things that you kind of balance. And so that's other ways to look at it. And sometimes you realize that that's probably the stuff that's working. And then the other thing is, I tell them that it can't hurt. There's so many things we can do that can hurt. Surgery is, has a lot of good and bad things, that can go along with it. It's pretty invasive, or medications have side effects. But I always say, why don't we try it? Why don't we try this plan, which is comprehensive, for 4 weeks, and then see. And if you don't think your dog's doing better, or we don't think so, we can revamp. But I try to just ask them to do a trial, because once they see their dogs improve, they're sold.
Okay, so I think the big thing to look for is that a veterinarian is involved and that a physical therapist is involved. If there's no veterinarian and no physical therapist, best in combination, I think that you're missing a link in the chain of what works. And so there's a couple of certification programs, and we have the initials after our name of CCRT, which stands for Certified Canine Rehabilitation Therapist. And it could also be CCRP. So these two certification programs train vets and physical therapists how to do rehab. And so you want to look for that.
And that program, just in terms of where people can find vets or physical therapists that are certified, is the Canine Rehabilitation Institute. So you can go to their website.
Yeah, their website is,
find a therapist.
I think it's caninerehabinstitute.com, and there's a section on there that says find a therapist.
But there are a couple other certifying programs too. IVAS is one for vets that you can help find acupuncturists, and the other certifying program for rehab is called.
It is also a certification program, and theirs ends in P versus ours ends in T. So theirs is a practitioner and ours is a therapist.
Just logistics.
Yeah.